Bangor. I've been a nurse for 4 years, and I've worked in healthcare for more than 12. I work on the surgical floor in a large hospital. The patients I care for have all different kinds of needs. I'm here today because not all of my patients are receiving the care they need. Healthcare is not a commodity. Healthcare is a human right, a basic right. Everyone deserves to get the care they need. I support accepting federal funds to expand healthcare coverage for 70,000 people in the state of Maine. These are my patients and my colleagues' patients. It's important to understand that these people don't have another option. Some of them are going to seek out care if they are sick enough, but care at what cost? There's the obvious potential cost of people's lives. The cost is also high for the family and communities who extend resources and care. But the option of last resource, preventable emergency care takes a heavy toll on all of us. Many of our hospitals are in trouble due to debt of under and uninsured patients, which often results in potential closures, cutting corners, and fewer services. As a nurse, many of the patients I see every day wait until they are so sick that we can't help them the way that we could have had they sought care earlier. They lose limbs. They may never get back to their previous health due to lack of access to care. Many times, these are things that could have easily been treated had they come and seen us earlier. Our current system limits us, as nurses, as to what we can do for patients. Healthcare decisions, like the decision to send someone home with a wound vac versus a simple dressing, is made according to the patient's ability to pay or even just the quality of health insurance they buy. Access to current, effective, and cost-effective treatments should not be denied based on the size of someone's wallet. All patients, all people, should have guaranteed safe, therapeutic, and effective health care. I want to urge all of the legislators to help me care for my patients and take the important step of expanding Medicaid services for 70,000 Maine people.
Yeah.
Thank you. Now I'd like to turn the microphone over to some of the people who are being denied basic access to care. After they speak, we will hear some closing remarks from Pastor Rick Neff.
Good morning. My name is Thomas Potasic, and I live in Portland. I am a veteran of the U.S. Navy, and I lost my MaineCare coverage on December 31st.
Hey, right.
My family has a history of multiple sclerosis, and I worry that I too may have it someday. But my VA benefits are limited and will not cover the cost of preventative care or any treatment for the disease. I need MaineCare for that.
We stand with you.
My name is Sarah Hotchkiss from Waldoboro. I am a professionally trained, self-employed piano user, which has been my livelihood my entire adult life. When the economy fluctuates, so does the market and my income. These last few years have been hard times, and therefore I have not been able to afford health care. If Maine accepted Medicaid expansion, I would not have to worry about my health care from one year to the next.
Good morning. My name is Joseph Kubetz from Portland. I'm in the process of growing a relatively new small business. And while things are picking up, and there's a lot of pride in what has been accomplished thus far, we are still not at the point where I'm able to afford health care coverage. MaineCare would help me through this transition without worrying that one wrong step or one wrong illness would ruin me.
My name is Peter Miller from Ellsworth, and I have a blood clot that requires weekly treatment. I take blood thinning and asthma medications. I don't make enough to qualify for Obamacare, but lost my MaineCare on December 31st. I would qualify for the expansion, and without health care, I will probably suffer greatly and be back in the hospital.
Good morning. My name is Susanna, and I stand here for my sister-in-law, Margaret, who said to me, I can't wait for the new health care expansion. I thought of her last year when I was upstairs listening to pro and cons about to override the governor's veto, and we are all disappointed. For many years, Margaret has worked a part-time job in order to care for my brother. He worked for 30 years in various mills in Maine, Yankee, and was diagnosed with COPD, which means he couldn't breathe. My brother passed away last year, and Margaret still has no health insurance. And if she got sick, there would be no one to help to care for her and no insurance to pay for her bills. If she had to pay all her medical expenses, she might lose the home and the organic farm she and my brother built. It would be a great loss for her and a loss for Maine, too. Thank you.
We stand with you.
My name is Sheila O'Neill. I'm from Helport. Usually very healthy, but microphone. Like most Mainers, I'm in my 60s and waiting for Medicare. I can't afford any of the tests the doctors want me to have, and I have no insurance when I broke my ankle. My income varies, but will probably qualify for the extension.
We stand with you.
My name is Marie Pinio. I live in Yarmouth. Several years ago, I was diagnosed with a heart condition that caused me to have to stop working. I now work as many hours as I can, but it is drastically less than I would need to afford or qualify for employee health care, and slightly too much to qualify for MaineCare anymore. Without MaineCare, I can't afford the preventive care I need to keep me healthy and working. I need MaineCare.
We stand with you.
Good morning. My name is Susan Charlet. I live in Lewiston. At this time, I am unemployed, and what part-time jobs I've been able to find have had no benefits or benefits extremely limited in coverage. Due to a health condition, high blood pressure, I need medication that is quite costly. And without a full-time job, I do need to be on the MaineCare. Because I was considered a non-categorical, I lost that MaineCare coverage the end of December. The medication, as I said, is quite costly, and I cannot afford it. Thank you.
We stand with you.
My name is Gail McLean. I own Thread of the Mill Farm in Gray. I lost my MaineCare on December 31st. Luckily, I am in good health now, but I worry that if something happens, I could lose my farm and everything I've worked for all my life. Thank you.
We stand with you.
Good morning. My name is Drew Christopher Joy. I'm a member of the Southern Maine Workers Center. Like a lot of folks in Maine, I work for myself doing carpentry and other odd jobs, depending on the season. I've been without health insurance since 2004. Last December, I injured my hand badly while I was working. At the emergency room, the doctors told me to follow up with a hand specialist, but I couldn't afford to. I just hoped that when my hand healed, I would regain full mobility and that I would still be able to do my work. I was lucky. My hand is fine now, but no one should have to count on luck. Healthcare is a human right.
name is Gina Melorano. I live and work in Auburn. After living in the British Isles for 4 years, I came back home to Maine and encountered all kinds of barriers trying to reestablish my health care here. But one that really stands out in my mind and is kind of quantifiable is that when I went to refill my prescription, I discovered that my medication here costs 50 times more here in the U.S. than it did overseas. And you're welcome to check my math. I can provide the numbers for you. So my thought is, if we're looking to cut healthcare costs, let's look at profiteering by medical industries and not at blocking healthcare access for people like us who need it.
My name is Jessica. I am a student who has tried to work my way through school. When I was 20 years old, I was working at a nursing home, and a 350-pound woman fell on me. I received inadequate care, and now I can't lift much of anything. For my 21st birthday, I lost MaineCare, and have not been able to get the blood pressure medication I desperately need.
Hello, my name is Jim Willis. I'm from Cape Elizabeth. I'm currently self-employed. However, I don't earn enough money to qualify for individual coverage under the Affordable Care Act. My only access to health care would be MaineCare expansion. I need this to keep me working, so one common cold or one trip doesn't put me out of work permanently.
Good morning. My name is Kate Cunningham from West Minot. I'm a graduate of the University of Maine system. I've been looking for work since I graduated in 2011, but I have not found a job yet. MaineCare had covered me during this time, but now I've been dropped and I'm without coverage.
My name is Mike Whitten. I live in Bucksport. I am here to speak for my son, who is 26 years old. He has mental health issues and had substance abuse issues in his teens. Without MaineCare, he would not be with us today. My son had a part-time seasonal job which ended last fall. This was the only work he could get. He lost his MaineCare benefits in December. He could not afford his monthly doctor visit and prescriptions, which exceed $400 per month. He suffers from severe social anxiety and depression, which makes it very difficult for him to work and interact with others. He's doing the best he can. Denying MaineCare to thousands of at-risk Mainers is neither right nor fair.
Hello, my name is Jeff Loxvickamp. I'm from Bangor. I work in retail and I am an artist, but do not make enough money to afford health insurance. I would qualify for MaineCare if our legislatures would take this opportunity to do what is right.
My name is Tom Binney from Whitefield, Maine. I want to thank the state of Maine because in 2012 I had a total hip replacement thanks to MaineCare. It is the reason I'm able to stand with you here today. In 2010, my wife Paula had a heart attack, and if we hadn't had MaineCare, we likely would have put off going to the hospital because it's so expensive. She made a full recovery because she got the care she needed on time. We lost our MaineCare on December 31st.
Hi, my name is Laura Pacheco, a self-employed artist and former teacher from Northport, Maine. I was uninsured and went without preventative screenings for years. When I found out I had seriously aggressive breast cancer, I was able to access MaineCare, and that was life-saving for me. A year ago, I was dropped and left without coverage as I continue my recovery from ongoing and debilitating effects of cancer, surgery, and chemotherapy treatment. MaineCare is essential for the monitoring and care needed to avoid medical crisis from medication complications or even death in the event of the cancer coming back.
Hello, name is Jeffrey Vane. I live in Portland. I've had MaineCare for the past 5.5 years, but I lost my coverage on December 31st. Having access to health care has helped me stabilize my health. I need MaineCare so I can afford insulin for my diabetes and medication for my high blood pressure. I also need to have surgery on my ankle, but can't afford it without MaineCare. Thank you.
We stand with you.
Hi, my name is Denise Parham, and I live in Portland. I have diabetes, chronic asthma, and high blood pressure, and need medication to help manage these health issues. I'm also looking to get into a rehab facility to help in my recovery, and I'm staying at the Florence house until a bed becomes available. I want to get better, I want to be me again, but I can't do that without MaineCare. Having access to health care would save my life.
We stand with you.
Good morning. How are you?
Morning.
My name is Rick Ness. I'm the pastor of the Wales Presbyterian Church. I want to talk a little bit about faith. You know, many faith traditions, including my own, aspire to perfection, completeness, or wholeness. That we should strive to be the best that we can be. This applies to us individually as well as together as our society, so that we can become that shining city on a hill that shines light to all. I also want to, I have a friend, my Father Mike Seavey, who talks about the Judeo-Christian tradition has long considered health care as a basic human right since the earliest of times. In the Christian tradition, Jesus' ministry to the sick, the injured, the marginalized, is a foundation to our work of healing and establishing moral societies where all people are cared for. Christians understand this work not only to provide direct care to the sick and the injured, but to advocate on their behalf to those responsible for the common good of society. There's a parable called the Good Samaritan. It's found in the New Testament, the Scriptures, compelling the followers of Jesus to seek out the sick, the suffering, those abandoned on society's roadsides. It's a story of a man beaten by robbers and left for dead. Two people passing by without helping. A third stops, dresses his wounds, takes him to an inn, and guarantees payment for future expenses. Commenting on this parable, Pope John II stated, "The parable in itself expresses a deeply Christian truth, but one that at the same time is very universally human. In view of all this, we can say that the parable of the Samaritan, the Gospel, has become one of the essential elements of moral culture and universally human civilization. We as a society cannot reach a state of wholeness or completeness when our parts are broken. The stories we've heard here today from our neighbors, our friends, are about brokenness. Brokenness from the lack of access to health care. Wholeness and wellness go together. They're inseparable. They are dependent on each other. This is our responsibility to our neighbor. This is what makes us a neighbor, and this is what's pleasing to God. So consider our neighbors. Megan with cancer, left by the roadside. Tegan with mental health issues, left by the roadside. Denise, left by the roadside. Amanda, left by the roadside. We've got new entrepreneurs, Joseph, Lucy, left by the roadside. We have an opportunity to make access to health care better or worse. I say, for those of us of faith, let us be guided to choose better. We are called to shine the light on those in the darkness, to heal the broken and not leave them by the side of the road. To my neighbors, to my fellow citizens, to those who heard the call to be our legislators, I implore you, choose compassion over conflict, light over darkness, healing over brokenness, mercy over money, and as citizens of the great state of Maine, let us strive to be the very best that we can be. And may God's blessing shine on all of us. Amen.
Amen.